know that changes happen. And
Yeah.
data changes, right? There might be some changes in structure of the data, how it's coming in, or in the medical device, I would assume if it's deployed in the population that maybe you didn't have enough signal, that can also impact the sensitivity of how the model responds. So this is a definitely big step, but it's also a lot of responsibility that it's being carried and a lot of management, if I'm understanding correctly from what
Yeah.
you're saying.
Yes,
So yeah,
absolutely. Yeah, it's just evolving so fast. It's like it's
yeah.
very hard to catch up. Like what all these companies are doing. Recently, I watched a video about Google Health,
Mm-hmm.
and I don't know whether you heard about what they are doing. So they are actually kind of deploying this cloud system where they have all these image, like they are making collaboration with all these like Bayers or sort of some of the
Mm-hmm.
hospitals, and then trying to take advantage of this Google cloud system, and then some of these algorithms
Mm-hmm.
in processing their imaging data, or even personal, health data. Uh, it's just to automatize and then even kind of suggest, some of the early sign of diagnosis, which
Mm-hmm.
is, I think it's amazing. And then I just learned about this federated learning.
Mm-hmm.
Yeah, yeah. So
Mm-hmm.
I did not know before, but now it seems like, because right about a month ago, I had a talk with somebody that I know who is in digital health development.
Mm-hmm.
And then the huge topic was about how you treat the personal data, because
Mm-hmm.
you know if you are just launching in the US, you just follow the US policy. But now, when you are trying to deploying the same medicine in globally, uh,
Mm-hmm.
right? And every country has
Different.
different, personal information, care system, and then protection system. And then in some cases, the personal data, health information cannot leave outside the country. So the
Correct.
data cannot cross the border,
Mm-hmm.
basically. And then in the case, if you are the developer headquartered in the US, your patients are in the UK, I don't know how they communicate. So that was kind of the huge topic. And now I heard about this federated learning system where you can actually deploy the algorithm locally, and they can actually update their knowledge without necessarily exchanging the raw data,
Yeah.
which kind of fascinates me. So,
It's moving very, very fast. And I think
yes.
you also brought in something that is very important in all of the healthcare type of environment, which is the personal information, the privacy of patients' information, and how this is. And I'm with you. It's varies by country. Europe is
Hmm.
much more it's much more stricter than United States. There are different guidelines and rules. United States has a very different rules when it comes to individual level and how you are treating it as well. So it is also very important for those who are listening as you're thinking about medical devices or healthcare data in general, just always check
Yeah.
what are the guiding rules of the country you are planning on working in, because it might be very different than what is in the United States. So
Hmm.
this has been extremely fascinating to talk about the medical devices because of the AI changing so much.